The Western New South Wales Local Health District is the epicentre of the state's regional COVID outbreak. But the vaccine rollout has been impressive. The Central West has recorded the fastest uptake of first doses in Australia. For more, I'm now joined by Dubbo Nationals MP Dugald Saunders. Dugald, thank you for your time this afternoon. The district is certainly leading the way. The Central West achieving incredible vaccine milestones, recording more than 80% first dose before Greater Sydney did. What do you put this down to?
Hi, Danica. Yeah, look, it's a pretty remarkable story when you actually look at where we've come from and where we're now heading to. I think every council area just about is well above 70 and most are now well above 80. Dubbo's at about 85% first dose, and we're between 40 and 50% second dose as we get clinics doing our second doses over the next couple of weeks. So, look, we've been extremely well supported by not just the local health district, but by the ADF, who have been here now for a few weeks delivering some of these vaccines in areas that would have been really difficult to get the uptake as quickly without those clinics. We've got GPs that are doing amazing jobs now. All of our pharmacists are on board. So, look, it's a real team effort, but certainly the ADF clinics have been the thing that's really helped take a big load off.
Absolutely, an incredible effort. What is the vaccine supply like now where you are? I know initially there was a lot of issues with supply, but where is it at now?
Look, the supply's been unbelievably good, to be honest. We've done, I think it's around 34,000 doses in the last 3.5, 4 weeks. So it's been pretty remarkable. Today was a bit of a feature day at the Dubbo Regional Theatre and Convention Centre with a focus on 12 pluses, but also any HSC students that hadn't had a first or second jab yet. We've seen some of our parks being used as the vision showing now. So look, we've had a really unbelievable last few weeks. Supply of vaccine has been good. And look, part of that is around the need to actually make sure that areas like ours were absolutely prioritised given the outbreaks that were occurring. So from Dubbo West to Burke and places like Wilcannia, there is no shortage of vaccine in this part of the world.
Case numbers seem to be lingering around the single digits for the last few days in Dubbo. Is there a sense that there is some stabilisation?
Look, we had single digits for the first time during the week since the start of the outbreak, Danica, and look, it was cautious optimism since that time. Across the region, we're back up into the 20s and close enough to 30 again. I think from what the health district is saying, from the public health workers, they're saying, look, it's probably likely to stay between that 20 and 30 mark again for the next week or so. We're hoping surveillance testing, which is something we've moved into, really pushing into some of our areas where there's been sewage detection or there's concern around community transmission. That surveillance testing is hopefully going to allow us to stay a little bit ahead. So with surveillance testing, the idea is you get tested, you don't need to isolate unless you're showing symptoms or you've been a close contact, so you can continue to work, which is a really important thing. We saw a slowdown in testing because really the results were taking a few days to get back, and in some cases more like 4, 5, 6 days, and that was just inconvenient and unacceptable. So a lot of people stopped testing. Surveillance testing means you can do it a couple of times a week. You can stay ahead of the game. You don't have to isolate unless you really need to, and we're hoping that will provide a really good way forward.